Hi, this video is to demonstrate how to use the DT-1200 product 197502 for foot neuropathy and the accessory 194703 for single foot neuropathy from Zopec Medical. Foot neuropathy symptoms include lower leg, ankle, foot, and toe pain, numbness, tingling feeling, and significant swelling. The DT-1200 was specifically designed with foot electrodes to help patients to relieve that pain, tingling, and numbness in those areas and to reduce swelling and improve blood flow and circulation to enhance healing. Let's start with your DT-1200 TENS, an EMS multifunctional electrotherapy device, and assume you're ready to go with the batteries installed. So make sure you have clean and dry feet. You can also wipe the pads with an antibacterial non-alcohol wipe. If you have heavy calluses, use a pumice stone to reduce the thickness of those, and this will improve the conductivity. If your feet are very numb, examine your feet daily to ensure any observed cuts or ulcers are addressed immediately. Don't use this device if you have any open wounds or ulcers on your feet. Wait until they heal. And remember to maintain daily hydration should you be doing electrotherapy. Now the first thing you want to do is connect one of the lead wires to your DT-1200 and put it into channel A. As you'll recall, channel A is on the left side. Just slide that right in, very easy. And now take the other end of the lead wire and connect your button adapters. They're a little tight, you have to push them on pretty snugly, like so. And take each of these and snap them onto the two foot pads, like 1 and 2. So it should look like this. Now put the foot pads on the floor. Make sure you've got enough wire there so it doesn't fall down off the table. Connect the foot pads to the floor, slip the shoes off. And get your feet on there. Now the next thing we're going to do, let's see, I want to remind you that if you're sitting down, just make sure you have adequate pressure. Obviously, if you're standing, you have a lot more pressure, but just make sure you get pressure on there. Now you want to set the DT-1200, turn the unit on, and then set it, go to the A channel on the left side, and go down to the bottom program so that the stored programs are flashing, and you want to get to, let's see, what was it? You want to get to program number 5. So get that onto number 5. There we go. Now toggle back up till the top numbers are flashing, and that basically is your power. It says MA. MA stands for milliamps. But just think of that as your stimulation. It's your power button. So what you want to do now is slowly raise that power button. And the reason you want to do that slowly is because it delivers the current very slowly to your feet. So if you do it a lot of times, all of a sudden it's going to get really strong, but not right away. It just kind of comes up later. As soon as you know how strong you want it, you'll be okay. But just the first few times, I'd like you to do that slowly. So get that to a stimulation that is strong enough for you, yet comfortable. And go ahead now and take the bottom button in the middle and set your timer all the way up to 30. See, it's starting to get a little stronger now. I'm still fine, but I would probably take it up a little higher. So now when that's at 30, you're all set to go. Do this 2 times a day, and you should see improvement in 2 weeks. In addition, you should also try the programs along Channel A, number 6, 7, and 8, to see if those outcomes are better for you. Now you can also treat one foot. If you only have one foot that has issues, all you're going to do, the only thing different is, I'm going to turn the unit off, you will take one of the button connectors off. And like I said, they're really tight. What you're going to do now is attach the button connector to a 2x2 adhesive pad. The adhesive pads are a little stickier if you put a little bit of water on them, so I'm going to slightly moisten that, like so.
attach it with the pin connector. And what you want to do is you want to put this somewhere along your leg. If you have more pain in the lower leg, maybe you want it down here, possibly have swelling all the way up your calf, you could put it in the back or in the front, just so you want to have a circuit going, and that's how we can get the stimulation down to your feet too. So now then just go through the same program as you did with the first one. Let's see, and if that's for treating one foot. There are ways to use this with other devices and to concentrate the stimulation again using floor pads. But I'd like you, if you want to look into that, please look at our other video for the DT-1200. It's the 197501. And remember also to contact your clinician for further information and accessories to assist you in your treatment. And thank you for purchasing the DT-1200.